traditional custodians of the land we're meeting on. I'm coming from the land of the Kulin Nation, which is here in Melbourne. And TL and uh, George, who are both our guests tonight, are both coming from Gadigal country in Sydney. Um, and I'd also like to acknowledge pay my respects to elders past and present. And I also want to acknowledge any Aboriginal or Torres Strait Islander people just joining us tonight and extend that respect to all First Nations people. Thank you so much for being here. I do apologize about my voice. I've lost it during the week, but it's slowly coming back. Tonight's session is focused on a really important but often under-discussed topic: migration and mental health for people living with HIV in Australia. For many of us, especially those on temporary visas, studying, working, or applying for permanent residency, migration processes can feel confusing, stressful, and deeply personal. Questions around how our HIV status affects your visa, how the health waiver works, and what rights you have can be very overwhelming to navigate. On top of that, there's the emotional weight of uncertainty, isolation, and the pressure to stay strong through it all. That's why for World Kindness Day, we've decided to create this space to share up-to-date, accurate information around migration and health waivers, to support mental health and resilience, and to build skill that can help you look after yourself while navigating these systems. And I think also most importantly, just the importance of connecting with community. We're joined tonight by two brilliant speakers: George Lombard, a lawyer with deep experience in health-related migration, and TL Tran, a social worker and counselor who brings a wealth of insight into supporting people through complexity and change. So before we begin, a few housekeeping things. This session is being recorded, but only the speakers and I will be visible or heard in the final version. If you also have any questions, please pop it in the chat box. We'll be monitoring it throughout the session, and we'll make time for Q&A after each presentation. The recording will be shared with participants afterwards so that you can revisit it or share it, especially if something sparks more questions for you later on. It's also important to say that migration law changes regularly. What's true today may not apply in a few months. So, while tonight's session is designed to give you clarity, it's always best to speak directly with a registered migration agent or a lawyer when it comes to personal circumstances. So with that, I'll now introduce our first speaker. So our first speaker for tonight is George Lombard, as I mentioned earlier on. His pronouns are he, him. George is a lawyer with over 25 years of experience in migration law. He's worked as a legal officer with UHNCR, as a government lawyer, and as a registered migrant agent. His current focus is on health and character-related migration cases. George believes that the global movement of people should be treated with the same openness as the movement of capital and goods, and that migration systems should be facilitative and protective. He'll be giving us an overview of how HIV currently fits into the Australian migration law, what to know about the health waiver, and what rights you have as someone living with HIV. All right, I'll pass it on to George now. Thank you, George.
All right. Migration to Australia is a very big industry, as we all know, and assuming people every day. And if you met video that are concerned about migration and HIV, I'm president of the New South Wales president of Migration City of Australia, which is a body representing migration agents, migration limits. I may not be in that position very much longer. I'm reaching the end of my tenure, but you'll reach out to me, see if I can help you find appropriate support if you need it. But I think let's go to the next screen to keep people in mind of what we're going to talk about.
George, can you also project your voice a little bit? Sorry. Thank you.
Oh, okay. I'm going to talk about the background of Immigration General, where they're going to talk about the visa categories, because this is very important to know exactly what you're applying for. Then we're going to talk about things to remember. You are HIV positive and you're applying. We're going to talk about some of the risks that I see occurring. And then one of the things that really does concern me a great deal is how people can fall into the hands of the wrong migration agents. So we'll work through those 5 issues. I'm able to see the chat, so if people do want to use the chat to ask me questions, go right ahead. I'm very open to that. Don't mind being interrupted. Okay. So the Commonwealth Government, which is based in Canberra, makes the rules for immigration to Australia. That's governed by the Australian Constitution. State governments, although they sometimes do tell you that they have a significant impact, in fact, they do things with the license of the Commonwealth Government. So, for example, there are various visa categories such as the 190 and 491, where the Commonwealth Government allows the state government to make input. But remember, always, this is a national program. There are actually probably over 2 million visas a year, but a lot of those are tourist visas where people just come in for a very short period. But there are as many as 1 billion visas a year in operation every year. In other words, it's a really big industry. It involves many, many rules and many delays. And I think one of the things I do see is people don't understand just how complex this is. So do give it some thought, get some advice if you can, and just be careful out there. All right. So the main 3 categories, there are family visas. These are people joining their family members as spouses, children, parents, etc. We see a large number of partner cases where one person sponsors another person. Remember that same-sex is not an obstacle to applying for a spouse visa. And there are various variations on that theme, but the main thing is at the moment, because partner visas are being processed so slowly overseas, up to 2 years in many cases, we see that people, as far as possible, do want to lodge a partner visa application in Australia, because that means processing time, if it's going to be 2 years, is at least spent while the people are together in Australia. People can also be sponsored by their parents, so there's child visas that are available. On the other hand, people can sponsor their parents, which is another thing which has got amazingly long processing periods. If you want to bring a parent, sometimes processing time is as long as 33 years. So before you lodge any kind of application, take processing time into account. It's possible to find that on the Department of Immigration website. And in family, we're seeing quite significant delays. So be aware of that and try to plan your visa applying as far as possible within those parameters. There are also skilled visas. Now, this includes students, and students are one of Australia's largest exports. Something like $50 billion is generated for the Australian economy by overseas students. And we do understand that many overseas students come to Australia in the hope of staying, and to the extent to which, if you're one of those people and you're HIV positive, you do need to do some really, really careful evaluation of where you'll go and what you'll do. In particular, I guess for many students, we see that it starts when they come to Australia and an overseas education agent sends them to a place where there's no work, although the courses may be expensive, but the agent is getting some sort of benefit out of the courses they're sending people to. So one of the first challenges that we see for students is that they quite often want to change and go into a course which is more appropriate to them. That's perfectly okay. I met a lady from Bangladesh today who came to Australia to study IT and is now doing social work. This is not uncommon, and it's probably the thing that I see quite often where people are taken advantage of, and be really careful if you can. And if you're already here, you probably know what I'm talking about. But anyway, I do worry a lot about students who fall into various kinds of errors. Skilled visas also include people who are already professionals, be they accountants, IT people, social workers. There are many other occupations. There are a lot of trade occupations. You can be a cook, you can be a carpenter, you can be a bricklayer, or even these days you can be a beautician, and you can get a visa if you've got the skills. You can be sponsored by an employer, or you can apply independently, sponsored by a state government. There are many different options, but one of the most important things I see there is that people need to be aware that skilled, even as students, you need to be in an occupation which is on one of the lists. There's no point coming to Australia and doing a course or presenting yourself as in an occupation which is not wanted in Australia. So make sure you study that at the beginning. Last category of visas we see are the humanitarian visas. These are refugees. They come from all over the world. Even recently, that's my dog. Recently, we've seen people coming from America who are claiming to be refugees because they're trans, and therefore they've been discriminated against quite severely by the new American government. But typically refugees come from third world countries, and typically people who are HIV positive may have some significant issues. It may be that it's not just being HIV positive. There may be other issues that come towards making somebody a refugee. I'm not going to spend much time on that today, but if anyone does believe that they're in need of protection, I'm more than happy to help make referrals to some of the agencies. Genuine refugees get supported by organisations such as RACS in Sydney, RILC in Victoria, RAILS in Queensland. So the first port of call is always to go to an agency which can give you free advice to see whether it will work. Like being HIV positive, virtually every visa category, sorry for the spell typo there, has a health criterion. Now, thing to remember, it's either 4005 or 4007. And 4005, that means there is no health waiver. 4007 is there is a health waiver. Now, I'll explain that in a minute, but first of all, some people, and typically you'd have to be HIV negative to come under the significant cost threshold at the moment. That significant cost threshold is $86,000. So if you have a medical condition, the attributed cost for that condition must not exceed $86,000 for the period of the visa. So if you're HIV positive coming to Australia for a year or two on a student visa, the costs will not be regarded as being overly significant. In other words, you will be able to get the visa. But if you're going for a permanent visa, then really, then the 10-year cost of being HIV positive currently is going to take you over the significant cost threshold. So while, as I understand medical science at the moment, you guys have to correct me if I'm wrong, but I think being HIV positive is currently regarded as a permanent condition. So therefore, they will always assess you over 10 years. So when going for a permanent visa, you will always have a difficulty with the way the Department of Immigration assesses your costing. And basically, it comes down to this, that there are two main medications that are used in Australia, Biktarvy and Dovato. And although 20% of applicants on Dovato, the Department of Immigration insists on assessing everybody on Biktarvy. And if you're assessed on Biktarvy, they say that the cost over 10 years is about $112,000. If you're on Dovato, then you're very close to the $86,000. So there's very little we can do about that. I've been in very detailed negotiations with the department recently, persuade them to allow Dovato be considered as a drug of choice. At the moment, they're not doing it. I've been having this discussion with the HIV and AIDS Legal Centre at Sydney as well. I'm hoping for good news, but right now, as we speak on, the 13th of November 2025, I cannot give you a guarantee that Dovato is going to be accepted. So therefore, as a rule, anybody going for a permanent visa will face a refusal if they're HIV positive, which means that you'll need to consider going for a visa which has a waiver. In other words, instead of condition 4005, you're hoping for condition 4007. Okay. I'm happy to stop there if anybody's got any questions. I realise this is quite complex, and anybody in the panel, or if there are any people want to put in the chat box, because I think this is really an important thing.
Yes. Let me pass on some of the questions for now. So, for example, the first one says, I think you may be talking about this later on, George. What do we need to prepare for health waivers? Would you be answering that later down the track, what they need to prepare for when it comes to applying for health waivers? And then the second one is, for those of us on Dovato, does that mean we have a higher chance of getting the health waiver to be approved?
In the future, as of today, I've been going through a really detailed and thorough negotiation with the department for a particular client. I still don't know what the outcome of that will be. So at the moment, I can't give a guarantee. But having talked to Health, HIV and AIDS Legal Centre, they're confident that this time next year, Dovato will be much closer to being under the threshold. They expect that Dovato will be accepted sooner or later, but today I can't give that guarantee.
No worries. And then the last question is injectable medication a lot cheaper?
No, HIV. I've only researched Biktarvy and Dovato because the department's costing in its official document, it only allows us to look at Biktarvy. And Biktarvy is the one that costs $112,000 over 10 years. Dovato costs very close to $86,000, very close to the threshold over 10 years. I don't know how much Cabenuva costs. We can Google that if you like. Well, PL's talking, I'll just check on that for you. Easy to do.
And then the other question is, if we import our medication from overseas, is that better for health waivers since the government won't pay?
Okay. Immigration always assumes that a person who has been assessed against costs for a visa, they always assume that you will take advantage of your rights and seek what's available to you for free in Australia. I've never ever seen them accept a guarantee offered by a client that you will bring in your drugs. If you say, I'm going to bring in my drugs, they won't believe. They'll always assume that you're going to just access pharmaceutical benefit scheme as soon as you've got the right to. But yeah, I know it's an attractive idea. I wish it was true. One of the things we see, for example, people who are haemophiliac, hemophiliacs all over the world have access to factor VIII medication, and quite often people from America or Argentina, many different places, they will have that sent to them anywhere in the world that they happen to be. The Australian government won't accept that if you're in Australia, you will access the rights that you have overseas. So we'll always assume that you will take advantage of the pharmaceutical benefit scheme. So therefore, it's a good idea, but it's not going to work, sadly. Maybe we'll in the future. Virtually every visa category has a health criterion, as I've told you. Now, things to remember: if you're applying for a visa and you are HIV positive, then review the Positive Migration Guide, which is available at that link on the HALC website. It's a little bit out of date, but the bottom line is that the major changes that have taken place since Labor came to power in 2022 are about the mechanics of skilled visas. There have been some minor changes to refugee visas, but really nothing significant apart from the change to the significant cost threshold, which is, when that was written, it was $51,000. Labor has increased it to $86,000. So keep in mind that the health statement there is almost entirely up to date and very reliable. Okay. If you are seeking a visa, it does pay to get advice from community legal centres. I mentioned them before, but good to see them in writing. Rails in Queensland, Rilk in Victoria, IARC or RAC in New South Wales. Just remember that there are advice. You can also go to Legal Aid in New South Wales. There are many different advices. The Asylum Seeker Centre, there are many places you can go. We do have one of the most complex visa systems in the world. There are many unpredictable aspects, so do get reliable advice. Don't trust your friends too much. A lot of people have obtained visas when laws were different, how they are today. One of the reasons our systems are so complex is because every generation of lawyers, going back to dawn of time, 1901, the laws have been changed and they don't always take account of how these changes may affect individuals. So make sure that you get reliable, up-to-date advice. And if your friends give you advice, it could be well-meaning, but the best advice a friend can give you is go to this lawyer, he's good and I trust him. Okay? Dealing with an agent, registered migration agent will have a number. My number, before I became a lawyer, before I registered as a migration lawyer, migration agent, my number was 96010056. That meant that I was first registered in 1996. So always look at the first two numbers of a registered migration agent. If a person is a lawyer, that doesn't apply, but if it's a registered migration agent, ask their registration number. They'll tell you how experienced they are. Then always go to the mara.gov.au website to make sure that they're still registered. Okay. If they're using a Gmail address or another generic email address on the Mara website, then either they're not very experienced or not very professional. That's another red flag for me. And of course, as I told you earlier, I'm New South Wales President of the Migration Institute. Always make sure that they're also members of the Migration Institute. That gives you another layer of reassurance that they're good. Okay. So in the minutes that I've got, I'll talk about loss waivers. So the way this works is if you are assessed as costing the Australian taxpayer more than $86,000 and you're applying for a visa for which there is a health waiver, so this could be a partner visa, child visa, employer-sponsored visa where you've been with the employer for some time, there are waiver opportunities that are available. And in those cases, if the cost of your condition is more than $86,000, the waiver works like this. The government basically does a cost-benefit analysis. They look at how much they think are going to cost, and they use quite sophisticated calculation mechanism to make sure that they can figure out how much you're going to cost. But if you're over $86,000, then it's a cost-benefit analysis. You have to show the government that you're worth it. So their first concern is going to be, do you have family members who are close to you, who really need you to be here? Have you got a connection to regional areas? I like to see people going out of the city into the country. Are you able to show that you're training Australians in the skills that you're coming to Australia with? Would it be hard for your partner to come with you to the country of origin? So, for example, quite often if you've married an Aussie, you find that they won't be able to speak many Asian languages and they'd be very bored or very lonely or very unhappy to go to another country. So there's some of the things that we look at, but the bottom line is that it's a cost-benefit analysis, and in every case we know that we have to show how much the person will bring to Australia in terms of assets, in terms of experience, in terms of economic benefits, as against how much they're expressed as being costing now. People with children who are disabled, it's a very tricky thing. It's something we don't need to worry about today, but we see some terrible things going on where children are assessed as being autistic when they're not. In fact, being HIV positive is pretty straightforward because I know that every HIV positive person will be assessed between $110,000 and $120,000 over that 10-year period because the government insists on using Biktarvy as the benchmark. If it could be Dovato, that would be lower. We haven't quite reached that point yet. Typically, agents will charge you quite a bit to do a health waiver because there's a large amount of data they have to work through, and they have to persuade a particular case officer. And so there are different fees that you can consider, different ways you can access this, but I would suspect that anybody who charges less than $4,000 or $5,000 to a health waiver doesn't really know what they're doing. And we see a lot of cases where people really do not know what they're doing. So once again, try to use that reliable agent mechanism if you can to make sure that you've got somebody who really knows. It doesn't hurt to ask them, have you done this before? Do you know anything about my condition? But the main thing is make sure that they present professionally. Okay.
Is if I have private health insurance and I don't use the public service, is this better for the health waiver?
When I'm doing the health waiver, that's true. If I can show that the person has invested in health insurance, that reassures the government that the cost to the government will be lower. Okay. So yes, do everything you can. One of the other things we do recommend is that where people are coming to Australia and are HIV positive, we say, make sure that you've made contact with a clinic in Australia which has some expertise in your condition. So, for example, in Sydney, we make sure that people make contact with the Albion Centre. And it's also important to show that you're bringing your medication, not your medication, but your medical records to Australia. So if you were under treatment in Bhutan, for example, your clinic in Bhutan would be able to make contact with the Albion Centre and make sure that your records are brought across. That means that the doctors in Australia have got a much better idea of exactly what they need to do for you.
Yes, and then the next one, aside from showing that we are healthy and with consistent undetectable viral status or load, what are the other tips to make sure that we have a strong health waiver, please?
Just be wealthy. Wealthy people get through easier than poor people. People who are working get through easier than people who aren't working. If it's going to be a cost-benefit analysis, you have to show that somebody in Australia, either the nation through your economic contribution, or through the teaching you're out provided, or a family member, if you're coming there with a partner. It's very difficult to give tips other than to just do your best. And remember that they will look at, for example, assets overseas. So I recently had a really difficult case where somebody has access to traditional land holding in the mountains of Papua New Guinea. He doesn't own the land, but he's got a right to it. And in terms of doing a cost-benefit analysis, we presented the notional value of the land to a case officer because we believe that you're entitled to show everything that you've got access to of value in showing that you are less likely to be a burden to the Australian taxpayer. So every little bit counts. Don't hesitate. If you think it might be relevant, just throw it in.
Next question, how long do health waivers usually get approved? I'm going crazy with the long waiting times. So what are the tips to make it speedy?
Unfortunately, if you try to make it speedy, you can poke the bear. All right. So we had an American guy who wanted to get a health waiver done quickly. His child was quite disabled, and he reached out to the department and he rang the government and actually spoke to the minister's secretary, and he got himself refused in a week. So don't do that. Don't push too hard, and just be patient. I know it's hard, but if you're in Australia, then you really got most of what you want. You can leave Australia on a bridging visa B if you like, come back. But don't push too hard, just be patient. One of the interesting things is that quite often a drug reaches the point where it's no longer as expensive as it used to be. So, for example, the drug which is known as Humira, which is used, for example, in cases of inflammation and rheumatic pain and things like that, that drug has recently become much cheaper, because the patent has expired. So sometimes waiting a longer time is actually in your favour. So I can't give you any great hope on that. I just ask you to be really careful not to push too hard. If you are going to push, I just ask what the situation is. HALC is very, very strongly politically connected, and you've got the HALC link there. Emil's put that in. Reach out to those people, or if you must, reach out to your local member of federal parliament. Must be federal parliament. Remember that this is a federal program, and you're entitled to ask them to see whether or not they're able to see where you're at. Your agents can also make requests when the application's been in the pipeline for some time, but don't even try to push it along yourself. If you do reach out to a local member of federal parliament, they will have an electorate officer who will be able to take your story, and they'll be able to come back to you in a week or two to tell you just how long it'll be. But just be careful.
Last two questions before we move on. New Zealand, Canada, and the US, all those countries no longer see HIV as a migration issue. Why is it still a problem in Australia?
Well, that's something that we talk to the government about, and the government, as I say, the Australian government has one of the most complex migration systems in the world, and they find it very hard to let go of rules which have existed in many cases for, in this case, for example, since the 1980s, there was an enormous scare campaign, and we still see the elements of it. It's also hard because the American government's decision to reduce funding for global aid programs meant that a large amount of money in Africa has been removed from the support for HIV positive people, meaning that we're seeing, if you like, a hardening of attitudes in Australia. We're trying to hold it back from going as far as Trump. But yeah, it's great that America, Canada, and New Zealand, for them, the threshold is over the cost of the medication. And we're certainly hoping that will come in Australia. Just hasn't happened yet, but I'm very sympathetic. Absolutely.
What would be the instances that the health waiver for people living with HIV to be disapproved? So please tell us so that we can avoid.
I don't know. Basically, we sometimes see people only discover they're HIV positive when they go for the medical. Comes as a big shock, and they're very scared. We always get them to talk to agencies like ACON and HALC to make sure they get good support. But in terms of doing something to get the visa, given we're confident the costs are going to come down for HIV medication, if you were refused, the best thing to do would be to lodge an appeal. The tribunal appeals are taking up 3 years, and I think it's a fair guess that by the time the 3 years have gone, then the cost of patents will have reduced, and more likely that their significant cost threshold will have increased. So that's the best advice I can give at the moment. I'm so sorry. There's no magic bullet.
Already submitted the health waiver. They're just wondering what to do next now that they're just waiting for it. Like, how long will it take, you reckon? And what should they prepare for next?
Oh, well, we see it takes anything between 2 months and 10 months to be asked for the health waiver. There are various queues inside the department. Things are processed at different degrees of speed, and so just be patient. Just wait. Something that you can do if you know it's going to be some time. One of the things that I quite often say is it's a really good idea to be shown that you're being a really good Australian and doing something for the community. Some people belong to their own community association. They join the school PNC. They basically, there are a lot of things you can do in the community if you like. You can do Meals on Wheels, like you do food delivery for old people or whatever. If there's anything you do which can be seen as being a contribution to the community, that's something that looked good on the health waiver. The department seems to like it when people are behaving like quite good Australians, unquote, so don't hesitate to do that stuff. And also be aware that they will look at your assets and finances. So, for example, if you have money that's hidden away, or if there are assets you haven't had valued, or some cases I've seen parents give children access to their inheritance in advance so that the person can show that they have more money. It's certainly the case that wealthier people get treated better than poor people, as I said earlier. So that's how you can prepare. Okay.
Thank you so much. Thank you. Thank you, everyone. And like I said early on, this session will be is recorded, and we'll make sure to share it as well for everyone, and also share George contact, and also the health HIV/AIDS Legal Center's contact as well. And as a lot of you would know, you can always reach out to us at any time so we could offer you some support.